in relationship to other physios and coaches, how do you handle disagreement with those who aren't always off base, but with whom you're not thrilled because of how they practice? I'm thinking of a classmate who is super sharp, but sometimes used passive/manual therapies out of what seems to be laziness, which in turn makes me want to disregard him entirely. Hopefully that classmate isn't listening. But no, it's totally fine. I like that question because it kind of hit home for me. I've hopped around a lot. I've had a couple different jobs over the last couple of years. So it's taken me some time to really find the environment that I love, which is Boston PT and Wellness. But I think a big thing with that I've had to kind of reconcile myself is that like you're not gonna find a clinician who's exactly like you, which is important. I don't think like we need to be exactly homogeneous and like we need to all treat the same way, especially with different populations and you've had different experiences in the past. I think like what's most important to me with that kind of stuff is someone's openness to at least listen and consider what you have to say. And it might take time for somebody like that to like maybe come around on something you truly believe, but if the environment has been fostered to kind of like be open to that change, that's what I look for. And I've had negative experiences with that in the past where like I've gotten a lot of negative feedback in terms of not just being closed-minded to change. And that's where I've kind of like, kind of either dropped the conversation or moved on. And with, in that situation, I would just look for that. And maybe also it's an opportunity for you to learn more about how you justify your beliefs. Because if like you're having to try to convince somebody about something that you believe, you have to really, kind of dig deep and understand like where are you getting your knowledge from and how justified are you in kind of demonstrating that to somebody else. I don't know how you guys have experienced that before, but that's kind of where I come from with that kind of stuff.
Yeah, I'll jump in. I love that sentiment, Mike, and I definitely agree that it's a really important thing to have the openness to, or for someone to have the openness to have those sorts of conversations. And if it's not there, I mean, there's not much that you could do about that as the person who's trying to affect the change. If they're not open to it, then they're not, and you kind of don't have too much else that you can do. And I also agree that as we're sort of passing judgment on what someone is doing, not necessarily, and I don't think it should be on who someone is, or passing judgment on someone, but maybe how they practice or this particular thing they've said, or that action. I think we also need to be scrutinizing what we do, and as you said, the source of our information. And I think that it doesn't need to be dichotomous. Like I think we could say, I can think of a few people offhand who, maybe I know, whether professionally or otherwise, and I could say like, I'm not really a fan of how they treat. Maybe I'm not really comfortable referring people to them. And maybe I can list the reasons why, but I, won't say they're not necessarily a helpful practitioner or that they haven't made people better, but this is why I don't agree with X, Y, and Z. And, it comes up sometimes with patients having conversations about their other health practitioners that they've maybe seen in the past or they maybe are seeing concurrently. And then I want to be very charitable to that person because I wasn't there. I don't know what happened other than what the patient might tell me, and then I'm forming an assumption based off of probably incomplete information. So even if I don't agree with something, I'll tell the patient that. I won't lie to them, but I'll also, if it's something that's already happened, there's not much point necessarily in saying that was crap unless there was something that was done or said that's having persistent effects now, like they've instilled a nocivic sort of idea in that person. Then we'll maybe talk about why it wasn't maybe wholly accurate, but I'll try my best not to disparage the reputation of the person, whether explicitly to someone else or internally within myself. It's hard to do. I'm not great at it, but it's something that I've been thinking about a bunch lately. Quinn, what do you think?
So the first part of the question, how do you handle disagreement with those who aren't always off base, but essentially who you disagree with? So to take that question at face value, this is very difficult, but in any discussion, you're not necessarily trying to be right, and you're not necessarily trying to win, kind of going back to what you guys have have already said, it should be a learning experience for both parties. Now, it sounds like perhaps, I don't know the other person, perhaps the other person doesn't really dive into the professional discussion, is not willing to question themselves or doesn't care. That's not necessarily your problem. You can still get something out of the discussion, even if you disagree with them, because sometimes that's as valuable. You kind of have an internal conversation in your head, was like, okay, how would I do something differently based on that statement that I disagree with, that type of thing. Doesn't even have to be a continued conversation with the person. It can just be in your own mind, so let's assume that the other person's not doing anything that would actually put the patient at risk. It's really sometimes, I think our emotion or our willingness or want to be right, and for the other person, like Mike, what you said, like nobody's ever going to treat exactly the same way that you do, but we feel like our biases are more correct. It's just inherent that way. So you just need to recognize that. And towards the second half of the question, this individual sometimes uses passive modalities. So that's not the issue. It doesn't seem like. It's what seems to be the issue is that it's out of laziness. And then the underlying issue there is that they're not providing a rationale that seems to be sound. They're not backing up what they do with some type of clinical rationale that would hopefully be somewhat evidence-based. Even passive modalities, you can say, well, I know it's probably a placebo, but it can change symptoms, and that's been shown. So like that, okay, at least that's better than, I was just tired today. So, I do understand that, but so that's like that little piece that you disagree with, because you've already mentioned that this individual is sharp and that they're not totally off base with other things, but your knee-jerk reaction is because you disagree with this one thing, that makes you want to disregard everything that they say. And you just got to be, there's nothing that we can say about that. You just got to be a little bit more disciplined in yourself to be like, okay, not everything he says represents that thing that he does. And that's a difficult thing. People do that to us too. Like somebody's probably doing that to you, and you wouldn't want that. You would be like, oh, okay, but that's just one thing. Look at all these other things that we agree about. So just kind of like try to take it from the other person's perspective. And I wish that we could maybe have like a hidden camera and watch these interactions, because I'm curious, Taylor, and I know, and I've met Taylor in real life, and so like I'm curious how you start the conversations. So are you starting the discussions with a question, which is generally a little easier way to kind of, or a nicer way to ease into a discussion like that? Oh, why were you doing that? Or like, can you explain that to me? Something like that, versus a statement, kind of a bold, where the other person now feels like they have to kind of defend, and they're all of a sudden, right off the bat, they're on the defensive. So just kind of watch how you're starting these discussions, and then use them as a learning experience for yourself, and don't necessarily try to the goal shouldn't be to try to convince the other person to be on your side, I guess is the bottom line for me. What do you guys think? Anything else on that? Good question.
No, I like that. It should be about like two brains that trying to like dice it out and trying to figure out like what you both know, what you don't know, and hopefully walk away with something to like question and look into further.
For sure. Yeah, and I like what you said, Quinn, about this should be a learning opportunity for the person asking the question too. Even if it doesn't go well, there should be, an opportunity for analysis. Why might it not have gone well? What could I do better the next time? And then, that's a plus.
Ultimately, we're all on the same team, right? Like we should be.
That's it.
It shouldn't be that like a competition like within clinicians, because who's the most important person in the room? It's the patient. So if the clinicians are fighting amongst themselves, trying to be the show, where does that lead the patients? It's just like sometimes we forget about that.
Yeah,
for sure.